So if you've got hip pain, it's time to get started. So there are some really good techniques for the hip. There's also different issues that happen with the hip. So the hip can have arthritis. The capsule can actually be very tight and almost shrunken. That in itself can cause a considerable amount of pain without having arthritis in the hip. And then you can also have inflammation inside of the hip joint. So with the regenerative injections that I do, I like to address these issues differently. And really having the physical examination, being able to look at your images and read your imaging report is very helpful, along with what you are experiencing. So, some of what can be done is, for one, you can actually expand that joint capsule. So all of our joints, our fingers, shoulders, knees, all of our joints have a joint capsule that surrounds that joint. And that joint capsule keeps a certain amount of synovial fluid inside of the joint in order to help with lubrication. The hip joint in particular, that capsule can become shrunken. And when that happens, you get a decreased range of motion. You oftentimes have tenderness when I actually examine and press on the hip joint. So just by expanding that capsule, you'll get greater range of motion, and it can start to decrease some of the inflammation that was more than likely the cause of some of that joint capsule shrinkage. Now, when you have arthritis, there's different degrees of arthritis, from mild, moderate, severe. Some people could be bone on bone. And so for something like that, we really need to look at what your goals are, look at what your lifestyle is, and design a protocol specifically for you as an individual with your goals and with your lifestyle in mind. Now, if you have just a certain amount of inflammation inside of the joint, well, for one, we want to find out why you have that inflammation. But we can address that inflammation either with injections, but we can also do that with certain supplements and or peptides. And so we have more options than just taking Motrin all the time, or trying to load up on Advil and Tylenol, because those can be detrimental in the long run for your entire body, not just for the joint itself. So it's important that you are looked at as an individual. It's important to address your hip, and to see also, why is it one hip and not the other? That's something that surprises me. Why that question isn't asked more often. If you've got right hip pain, why is it the right side and not the left side? Is it from an injury that you had that was the ankle, the knee? Is it some kind of movement that you do on a regular basis that's causing that particular problem? It's so important to address the root issue, because if the root issue isn't addressed, then you have a higher likelihood of having that pain come back after you've had the regenerative injections. And so more than likely, you're going to have to learn different corrective techniques and learn different movement patterns in order to get yourself out of these old habits that have that you were compensating with because of having this chronic hip pain. So this is something that we can address. Make an appointment. Look down in the description below so you can make an appointment. And if you have questions, just put them in the comment. And I'm sure the questions that you have, other folks have too. I'd be happy to answer them. So I look forward to seeing you. Please share this with other folks that have had hip issues. like and subscribe so the algorithm starts to send this out to other folks, because it's really important that you try to avoid surgery at all cost. As soon as you start having issues with your hip, you want to address it as soon as possible so that you can correct it and you can avoid the knife. Okay, thanks, bye-bye.